Welcome, everybody, to another edition of Rock Solid Wellness. This is Rich Petrus. I'm a naturopathic doctor, an ND from West Virginia. And in the series that I'm teaching, it's a six-part series on gut health. Most people don't really realize how important a properly functioning digestive system is to your health or a lack thereof. So that is the purpose for doing what I'm doing. Started off teaching this series by relating information from the World Health Organization on parasitic infestation and how important it is to make sure that we understand that that's a problem. 95% of the people in this country have parasitic infestation. You worm your dogs, you worm your cats at the vet, uh, get wormer from the vet for your horses, but we never consider that as an issue for ourselves, and it's a big problem, especially if you're a person who goes 2 or 3 days without a bowel movement, maybe a week, maybe 10 days or even longer. That is a major problem. And I started off this edition in this series by talking about the fact that over the past 30 years or so, in helping people to try to get well or improve their health, at least 3 out of 4 people that came to us with that issue. That's the first question I asked them. Do you ever go more than a day without a bowel movement? And the answer was always yes. In most cases, 3 out of 4 times, people would say 2 or 3 days, 5 days, 7 days. That had to be corrected. And in every situation, when we taught them how to properly digest their food and take something to properly eliminate that quickly, the food that they eat the day before, and have 2 or 3 bowel movements the next day if they have 2 or 3 meals the previous day, invariably, every single time, the symptoms that they were experiencing disappeared, even though they were maybe even treated by a medical practitioner for symptoms of some type of disease. If it was caused by a gut that was poisoning them and promoting those symptoms, when they started properly eliminating, those symptoms disappeared. So we learned that over 30 years of helping people, and are going to pass that information on to you. Last video that I did, it was the 1-2 punch of using probiotics versus prebiotics and probiotics, how one is beneficial to the other. Probiotics are extremely important. That's the good microflora in our digestive system. Uh, and today I'm going to be talking about better gut health and improved digestion. Again, that is so important. If you eat 2 or 3 meals a day, if you eat 2 or 3 meals today, you should have 2 or 3 bowel movements tomorrow to thoroughly eliminate what you've eaten today. What happens if you don't? Well, many people have 3 to 5 to 8 to 10 or more pounds of undigested, putrefied, rotting food in their small and large intestine. That is not that is not conducive to good health. And if that's the case, that has to be removed from our digestive system before we can have experience optimum health. Okay, so let's go on. Let's get into what I'm going to talk about in the brief presentation today. Let's go back to prebiotics for just a minute. Prebiotics, let's make sure we understand that they stimulate, when you take a good prebiotic, they stimulate the growth of good bacteria in our gut. How do they do that? They act as food. The prebiotics, which are undigested food fibers, they act as food for the probiotics, which are the beneficial good bacteria in the large intestine. Without prebiotics, the probiotics have a very difficult time surviving or creating the proper ecosystem in that gut, in the large intestine, to provide maximum benefits for good health. And a lack of beneficial microflora means that there is an imbalance. There's an imbalance of harmful bacteria and toxins present in the gut, which translates to negative health consequences for that particular individual. Let's look at a benefit to probiotics. as your gut bacteria metabolizes these probiotics, which are undigested food fibers, from they produce short chain fatty acids. These are compounds in the gut that boast a wide range, a huge range of benefits for us as individuals in trying to get healthy and stay healthy. One of them is butyric acid. Um, it's a fatty acid that improves the health of the intestinal lining. Short chain fatty acids also regulate electrolytes in our body. Electrolytes such as sodium, potassium, calcium, and magnesium. These are alkalizing minerals. It's important for our cells and everything except our stomach to be alkaline in our body to promote good health. So also we need to consider the fact that short-term fatty acids promote proper digestion, and they support regularity, which is so vitally important. And they relieve digestive issues, like, and for example, the two most common digestive issues that we ever worked with in our business were diarrhea and constipation. More constipation than diarrhea. The negative changes to the gut microbe composition are classically considered as one of the many factors, folks, involved in the development of things like inflammatory bowel disease or irritable bowel syndrome, both of which are treated extensively and long term by medical doctors. In a properly functioning gut where there is good balance of microbes, conditions such as diarrhea, especially. Uh, Many times diarrhea develops after taking an antibiotic. That can be fixed very quickly. Certain intestinal infections and chronic disorders like Crohn's disease. This is a condition that's treated for, and sometimes people never get over it. They deal with it and take medications and treatment or surgery for years and years and years, maybe their whole life. Um, Ulcerative colitis, an infection in the gut, symptoms of irritable bowel syndrome, inflammatory bowel disease, and here's a big one. You know, anyone that ever went to the doctor and they were diagnosed with something called leaky gut? Well, leaky gut and all the other things that I just mentioned can effectively be treated, even prevented, by our own gut if it's functioning correctly versus treatment by medical practitioners who use prescriptions and prednisone and other types of treatment or medical procedures. So we've got to make sure, folks, that number one, as I talked about in previous videos, that we eliminate on a timely fashion. And that means we have to digest our food thoroughly. What we eat today must be digested in the stomach, converted into a liquid, which goes into the small intestines, where the small intestines removes the nutrient from that liquid that is in there and transports it to the liver. The liver converts those nutrients to sugars and transports the sugars to cells to feed us. That's how our body works if our digestive system is working correctly. Then that waste moves down through the small intestine through the ileocecal valve to the large intestine, where it goes through a transport of 6 feet of ascending, transverse, and descending colon down through to transport out of the body as waste. That should happen within a 24-hour period of time. Everything we ate the day before should be eliminated the next day. That's got to happen for you to experience all of the benefits that I talked about last week. And we've got to make sure that if we are a person who was sluggish in our bowel elimination and we correct that, and it's easy to do it. It's very easy and it's very inexpensive to get to the point where we eliminate like we're supposed to 2 or 3 times a day. And if you want to know how to do that, you can call the office here, 304 534 5490. Again, that's 304 534 5490. and I will teach you how to do that. So let's get that problem taken care of first. And then we can make sure that we do a parasite cleanse to make it as a probable situation that if you're experiencing sluggish digestion and you're going to have parasites, and we've got to make sure that we eliminate those from our body, because that can be a deadly situation. Believe it or not, it can cause major, major negative health problems. So in order for uh, me to be able to show you how to maximize your health by using in what I believe is the most effective, miraculous formulation ever created in medicine. And it's a natural formulation. And it developed after 45 years of scientific medical research. It is a cellular activator. And there are a few people, of a certain small percentage, that we've used this formula with, and the thousands that we've introduced it to, a very small percentage say to come back to us and they say, Dr. Rich, I don't feel anything. It's not working. I'm not getting any results. I had tests and so on. And I can tell you emphatically that if that's the case, and we use that formulation with everybody, it is the biggest breakthrough in medicine ever, ever. If in order for that to work and do what the research says that it is supposed to be able to do, and designed to do, we've got to make sure that the gut is working effectively. So number one, we've got to make sure that whatever you eat, you digest. Timely fashion. Everything. In today, out tomorrow. After that happens, utilize a good pre and probiotic to maximize the health benefits of your digestive system. Um, we've got to make sure that we eliminate all the parasites in the body and do that at least on a biannual basis. Important to make sure that we are like our dogs and cats and horses, that we're parasite free, and take the yellow cellular activator after our bowel and gut is working correctly. Folks, that's the way to get to maximum health. You can do it yourself without a prescription. It's a proactive approach to take. But if you want even prescriptions to work, if you want nutrients from your food, if you want to eat a good diet and exercise and drink good water and get all the benefits of everything that we've been teaching on this channel, your digestive system has to work correctly. Even your prescriptions won't work correctly. It won't be metabolized and utilized by the cells of the body the way they're designed to work if you don't have good gut health. So the next video that we're going to do is the prebiotic effect on the immune system. How to enhance the immune system. 90% of the immune response is garnered or occurs in this gut that I've been talking about. So until next time, good health to you folks, and tune in for the next presentation and call me if you need help. I'm here to help you. All right, have a good day.